Hi there, everyone. Thank you so much for joining us for another of Insight Collaborative's webinars on issues around migration. Today, we will be talking about moral injury as it pertains to migration in terms of how it affects refugees and humanitarians and journalists covering conflict areas. This is a really timely topic for a variety of reasons. I remember last year we actually held a discussion on a different aspect of moral injury, and even only a year ago, it felt like, to the limited extent which it was being talked about in the public discourse, it was primarily being talked about as it related to veterans and in healthcare. And already, I think you'll see from some of the work that our panelists are doing that it's already being looked at in a much wider sense, and we're really pleased to be able to bring some of that to you today. I'll just introduce our panelists and then we'll start the discussion. So I'll just start with the order they appear on my screen. So first of all, we have Lisa Schwartz, PhD, who is the Arnold Johnson Chair in Healthcare Ethics and also the Professor in the Department of Health Research Methods, Evidence and Impact at McMaster University. She is the senior primary investigator on a program of research studies examining the ethical challenges faced by humanitarian healthcare providers called Humanitarian Health Ethics. Her recent studies focus on research ethics during times of Ebola and palliative care in complex humanitarian emergencies, including with refugee communities. The next person on my screen is Diana Reyes, who has worked for the World Health Organization, the Syrian American Medical Center, the Migration Policy Institute, and has consulted various academic institutions, NGOs, and EU and UN agencies on refugee health trends and humanitarian health needs inside Syria. Diana is also a former recipient of the Fulbright Research Fellowship to Germany. She has published widely on humanitarian health trends in Syria and is a steering committee member of the Syria Public Health Network. She holds an MHS in Global Mental Health and a certificate in humanitarian assistance from the Johns Hopkins Bloomberg School of Public Health and a BS in psychology from Arizona State University. Next on my screen is Anthony Feinstein, who is Professor of Psychiatry at the University of Toronto. His MS research is focused on determining cerebral correlates of depression and disorders of affect, the use of computers and distractors in eliciting cognitive dysfunction, and the behavioral effects of cannabis and the mechanisms underlying these behaviors. A second strand to his research relates to the study of journalists in conflict situations. He has published a series of studies exploring the psychological effects of conflict on journalists covering various conflicts, the refugee crisis in Europe, and the aftermath of the 9/11 attack. He is the author of In Conflict, Dangerous Lives, War and the Men and Women Who Report It, and many other books, journal articles, and book chapters. In 2012, he produced a documentary, Under Fire, based on the research of journalists in war zones. It was longlisted for an Academy Award and won a Peabody Award. And then last on my screen is Dr. Simone Delahey, who is a clinical psychologist and psychotherapist, supervisor of behavioral sciences, and senior researcher at ARC Centrum 45. Both her clinical work and research concerns traumatized refugees and asylum seekers at the outpatient unit. This includes research on and treatment of moral injury. So those are our panelists today. We feel very lucky to have them with us, so thank you all so much for joining us. If any of our audience members would like to ask questions of our panelists, you can type it in the chat box, and you can also send that to me directly if you want to ask anonymously. We have a series of guiding questions today, but we're more than happy to hear other questions as well. So our first question for all of our panelists is, please can you tell us more about your own work with moral injury and mental health? And perhaps we could go in the same order that I introduced everyone in. So Lisa, are you happy to start us off?
I'm happy to. In a way, I feel like I'm going to skew things a little bit because my background is a philosopher, not in psychology or psychiatry, and I'm involved in empirical bioethics. So the work that we've been doing, I guess I think going back to it, first of all, that moral injury is treated a little bit differently in philosophy than it has been in the psychiatric and psychological contexts, because it's fastened, I guess, to perpetration. The people who are perpetrating a kind of harm, and also to the individuals who are experiencing it, and living with the harms. Oh gosh, see, I thought everybody else was going to start ahead of me, and I wanted to say to compare it to everyone else's perspective.
Oh, sorry, if you prefer, Lisa, we can start with someone else.
I wonder if it would be better, because I think it'll be easier for me to do this at a point where I can say, okay, and then here's a different way of thinking about it. So please do, because I think you have more expertise on this than I do, if that's okay. Sorry.
Of course, absolutely. Is there someone else who would like to jump in?
I'm okay with that.
Sure.
So my introduction to moral injury was somewhat fortuitous. That I'd been doing a series of studies looking at journalists covering conflict, going all the way back to the Civil War in the Balkans, and did work after 9/11, and the war started in Iraq and Afghanistan, doing studies in all those environments. Did a study in Mexico looking at drug violence and how that was affecting journalists. And then a few years back, I got a commission from the International News Safety Institute to say, there's large numbers of migrants moving across Europe. How is this affecting journalists, and how are they managing their coverage of this humanitarian crisis? And so we did a study with, I think, 9 or 10 European news organizations. And in fact, we didn't find high rates of post-traumatic stress disorder or depression in the journalists, but what we found was moral injury. And the challenge that we faced at the time was that, and you said it in your introduction, the military were very familiar with moral injury, but journalists were not. And the kind of research that I do, which is quantitative, we kind of record symptoms and we kind of rate their severity, relies on self-report rating scales that have been validated with things like depression and post-traumatic stress disorder and anxiety, but there is no moral injury questionnaire for journalists. The military have them. In fact, they have more than one, because the military have been battling with this for a long time. But we had no way of psychometrically recording the properties of moral injury because it doesn't exist within the field of journalism. And my lab right now is trying to develop just such a scale that is very particular to journalists, because you can only borrow so much from the military. These are obviously two very different professions, and you can't take everything from the military and apply it to journalists. It just doesn't fit. But what we saw that in this large study of journalists from many different countries was that they were confronting very difficult moral choices and having a sense of moral injury as a result. And I think it's useful just to perhaps mention one definition of moral injury. I recognize there's more than one, but the one that we've used as our framework is a sense of moral hurt or moral injury that can arise from witnessing or perpetrating or failing to prevent acts that transgress our moral compass. And this certainly applied to journalists who were covering the migration crisis in Europe. And the classic example was, journalists would find themselves on a beach in Greece or whatever, and there were no first responders. They were just journalists, and a boat would wash ashore with migrants. And then, what are you supposed to do? Are you supposed to take photographs? Are you supposed to wade into the water and save people? The humanitarian impulse was to do that first, but then they might miss the story, and then there'd be pushback from the bureaus in New York or Toronto, wherever it was. And so there were these uncomfortable dilemmas that they hadn't prepared themselves for that really came to the surface when it was dealing with migrants. Many of these journalists in these countries were working in their own countries. They were not flying off to a different country to report on something. This was their own country dealing with this crisis. And they became ashamed by the response of their fellow citizens to migrants. And they had a sense of moral hurt from seeing how people within their own country were responding to refugees and migrants. There were multiple layers on this very fascinating topic.
Thank you. Yes, I can't imagine. I mean, my own background is in the humanitarian sector, and I've also been on the beaches, and there's enough internal conflict and moral injury being there as a humanitarian, but at least as a humanitarian, that's what you've gone there to do. I can't imagine the level of internal conflict that a journalist would feel having gone there almost for something entirely differently, but as you say, still feeling that humanitarian impulse. Mm-hmm.
Yeah, absolutely. And then, the bureaus back home wouldn't get it. And there'd be this conflict of, why are you there, to report the news or to save people? And when you intervene as a first responder, as a humanitarian, how far do you go? Where does it end? And, so many good deeds ended badly. No good deed goes unpunished. And so many things that journalists tried to do didn't end up the way they hoped it would do. And so that caused a whole lot of extra moral hurt as well.
Absolutely. Thank you, Anthony. I think that might be a really good place to call Diana in if you're happy to give your thoughts next, Diana.
Sure. Thank you so much, Daniel, and Dr. Feinstein. I think I'll start by saying that moral injury as a concept and a terminology is not something that I've used explicitly in my research, which is what intrigued me so much about this webinar and the chance to sort of think about it from a new perspective. Most of the work I do with refugee populations or internally displaced populations centers on, common mental health disorders, experiences of trauma, especially in contexts of war and conflict. And specifically the work that I've done, I think that pertains to this topic the most, is my work with health workers inside Syria who've experienced attacks on healthcare and are, faced with many difficult decisions under these circumstances where they have to triage patients in a particular way, think about saving their own families while also saving, civilian lives. And also if they want to stay and continue to serve the population in need or to save themselves and their families and move to another country. So a lot of the work I've done, I'm a qualitative researcher by training, so have been in the form of interviews and narratives. And when you speak to people and you talk to them about, these traumatic events, they will tell you, sort of these dilemmas that they experience. And I think in my own research, we framed it a lot as ethical challenges or, kind of trauma and secondary trauma experienced as a result. But I think looking at the definition of moral injury, it actually is much more applicable to what I was hearing through these interviews and even the ways that people were coping. So under unimaginable stress and trauma, they were turning a lot to sort of their spiritual beliefs as a means to cope with what they were seeing, and a lot of reliance on God and sort of meaning making of the situation that they found themselves in, and thinking about how to mitigate it through just thinking that this is their fate and that their fate is to help people even at the expense of their own lives. So I think qualitative research, in addition to what Dr. Feinstein was mentioning about quantitative research and using scales to assess moral injury, I think qualitative research in addendum can also be very telling about experiences of moral injury, and can start to place this term on the map, I think, a little bit more, because even using a public health lens, I think we tend to think more about classic definitions of trauma and secondary trauma as experienced by individuals or researchers or journalists or practitioners working with these populations. But I think moral injury offers a new set of tools in terms of how to address these problems and how to mitigate them. So I'll go ahead and stop there, but I'm looking forward to talking more about some of the research that I do and how it applies to this topic.
Thank you, Diana. That's really interesting. And I completely agree with you on the importance of bringing in both qualitative and quantitative strands of research, especially on a term which is still maybe not widely understood. Lisa, do you feel like that gives you enough to be working with philosophically?
It does. I hope that's okay, Simone, that I would do. But I should have paused again and just to say a little bit about also the background of what we've been doing. It sounds similar to some of the work that Diana's been involved in. So we also started our work by looking into the experiences of ethical challenges that humanitarian and healthcare providers were encountering when they did work in the field. And initially, because at the time there was very little work being done to support sort of the bedside ethical issues, there was quite a lot on big picture ethical issues of humanitarian, issues writ large. But what happens for the doctor or the nurse or the practitioner who's at the bedside? And there was no guidance at the time that we started. So the first thing we wanted to do was figure out what the issues were. And so we began with a qualitative study to kind of collect and cultivate. And I think in terms of moral injury, where we might have used the term moral distress or maybe moral residue, the things that were being described many of the respondents talked about feeling complicit in negative actions in the same way that Dr. Feinstein was describing individuals feeling as well, that they wanted to be doing the right thing, but in order to do that, they found they also had to somehow compromise something that was a moral commitment that they normally wouldn't have wanted to. And they asked questions about how far do I bend before I break? And at what point can I draw that line in order to function and come back feeling like I was doing the right thing? My sense of it is that maybe the word complicity is potentially not the right one to use here, and we could explore that more fully. But my sense is that people became morally entangled in activities that they would ordinarily have rejected or maybe stood up against, but felt that they just didn't have the choice or even the right, or that their ticket to staying, right, their opportunity to stay in place involved having to be complicit in those sorts of ways. And more recently, we're looking at what that means when an aid organization goes in to do work, to the trust relationship with the people that they're planning to work with. So I think there's an opportunity maybe in the process, and I've been looking at treatment for moral injury, if we're thinking about it from a psychological or psychiatric perspective, and as a philosopher, I think I often say that treatment is not about the internal work that this individual has to do. I think that's part of it, without any doubt, but it's also about seeing what's externally unjust and responding to that and giving them the sense that maybe they would be able to manage that. And I think I've seen that in the work of Dr. Feinstein and Dr. Delaray, which I guess we'll hear more about. So I think that's a start. So it brings us to that set of considerations. And the other thing, I guess, that I would raise just very briefly before moving on is the difference between what a humanitarian actor experiences in terms of moral injury and the moral injuries that are perpetrated upon, I think, the people, the affected populations that they work with, and that we should probably treat these things somewhat differently, although there's plenty of overlap there. But the malignant disrespect for dignity, let's say, that exists in crisis situations, and that's probably experienced by refugees, it deserves or requires, again, a different kind of response, because I don't think that the refugees are necessarily feeling complicit. I think they're just experiencing that harm and more directly. So those just a few thoughts to answer question one. That's good.
Thank you, Lisa. I think those are some really good points. And yes, I completely agree that although almost any population can experience moral injury, they will maybe require different responses or interventions or attitudes to work with that moral injury. And also, like the word you used, complicit, that feels like, to my mind at least, that feels like the most applicable word. If you're trying to sum up moral injury, then that feeling of being complicit in things that you didn't actually maybe have a choice in, but you feel like you did, or you feel like you maybe should have made a different choice. That feels like a really good summary of it, so thank you. And finally, Simone, there's a reason I've been saving you for last, which is I very much wanted to look at the bigger picture first. And I know that you've been working directly with people who have experienced moral injury. So we'd love to hear more about your work kind of on the grassroots as well.
Yes, I work at a department for refugees and asylum seekers, and I treat people with refugees with traumas, with PTSD, post-traumatic stress disorder or depression. And what we noticed is that the refugees have accumulation of traumas before they flee the country and reside in the Netherlands. And what we noticed that the traumas that have a very big impact on people are the traumas that people felt they had a choice. They needed to make a choice between two evils. and they feel remorse and shame and guilt because of it. And this is also what we know as moral injury, which in itself is not a mental disorder. It's not at all. It's not in the classification of the psychiatric manual, but it can go hand in hand with a disorder like PTSD. So when treating PTSD, it's important to also address the issues related to moral injury and those specific traumas in which people felt they had a choice to make. And it's always about something they did or they witnessed and they did not prevent something from happening that affects them the most. So we see a lot of people from different backgrounds who have been in war or a victim of persecution, that they felt they suffer from moral injury. So we do research into how often this is the case and what kind of experiences, what kind of moral injurious events are people confronted with. And then we also look into how we can treat this. And what we do is we focus on these moral emotions that are provoked by these events to help them to deal with it.
Thank you, Simone. That sounds like really important work, and I'm really looking forward to hearing more about that throughout our discussion as well. I'll move on to our second question now, which is almost the meat of the discussion, really, which is, how does moral injury impact on mental health? And that's especially in the populations that we've discussed so far in terms of refugees and humanitarians and journalists. As we've been saying, moral injury can affect many other populations as well, but there's a whole host of research out there on populations like veterans and healthcare workers. So yeah, we're particularly interested in these populations. Anthony, would you like to start us off again?
Yeah, so the primary emotions that you see linked to moral injury are things like shame and guilt, which is what Simone has spoken about as well. Anger, we certainly see anger in journalists. I'm really pleased that Simone raised the point that moral injury is not a mental illness. I hope it never does become a mental illness. That's a separate question, but I think there's this creeping annexation of everyday life and pathologizing everyday life. And I think it's going to complicate things immeasurably if moral injury is determined to be a mental illness. But it is associated with post-traumatic stress disorder. It does become the conduit to disorders like depression, of which guilt can be very profound. And I think the example that has really stood out in my work recently within a Canadian context was working with journalists who were covering the story of the murdered and missing Indigenous women in Canada. And this is a very painful topic, obviously. And the journalists, most of whom were women, found it very difficult to work on the story. They were just confronting so much pain and survivors and family. And it turned out that what the journalists really were experiencing was a sense of moral shame, that that a country had allowed this to happen, and there was a sense of collective guilt almost on the part of the journalists. And then then you have the consequences of where does that lead people, and you don't just feel guilty or feel ashamed or angry about things, but you start changing your behaviors. And journalists started to respond in a way that they weren't trained to respond. They started to take on responsibilities out of compassion, well-meaning, that perhaps they shouldn't have taken on. They started to assume the role of like quasi-social workers or getting involved in the lives of people that they're reporting on, behaviors that were being driven predominantly by guilt and shame. And they were getting into deep waters. And once they were in, they were having problems navigating how to get out. And they felt just trapped by the enormity of what they were experiencing. The well-meaning intentions backfired in some ways and started to cause more intense emotional distress. And I think, the reason why this happened was in part because people were just not familiar with what moral injury is. They didn't understand how it might arise and what the consequences of moral injury are. And, what are the consequences of being exposed to morally injurious events? How does it change one's behavior? And I think if you don't have an understanding of that, you get trapped by it and you can make mistakes. And this is what the journalists were doing. So I think that the consequences for individuals' mental health can be quite profound. I mean, the military have known about this for a long time. It's just that other professions are playing catch up to what the military have understood for decades.
Absolutely. Yeah, as you say, the military have known about this for a long time, and the rest of us are just playing catch up. And thank you for bringing in the Indigenous situation, because that isn't something we've discussed so far, and that's really interesting, and of course very sad to hear about that experience and the effect that awful kind of revelation had on the journalists covering it. Lisa, could we perhaps call you in there, because you're based, was it Ontario, did you say? So I imagine this whole issue must be a bit closer to home for you.
It's very immediate, in fact, not in my personal history, but I do work with Indigenous colleagues, and then based on treaty territory. We're in the District 1 Spoon Wampum Agreement, so I recognize that these territories are not our own. And I've just come from a meeting actually where we were discussing land acknowledgements and how to bring them to life. And I think there really is a strong sense of being implicated in that history, and that if we don't do something active, so I can imagine how these journalists that that Dr. Feinstein was just describing would be wanting to do something active for the people who are affected at this moment. And if we don't do something, then again, that sense of feeling complicit. And so, bringing it back to the broader discussion, although I think we could spend the full hour talking about what's happening in Canada and the US and in other places where Indigenous communities are bringing things to light that we should have paid attention to long ago. But I think that there is a difference between feeling complicit and actually being complicit. And that we have to be attentive to that. For the longest time in philosophy, we've talked about the doctrine of double effect, where an unintentional evil is brought on by acts that can and are supposed to bring about good effects. And I think for humanitarian actors, at least in the experience of moral injury, there is in part a sense of responsibility for things that they didn't necessarily bring about or intend to be complicit with it or aligned with in some ways, but just to be able to be there made it necessary for them to align with other goals, again, that don't match their own values and their own ethical commitments. So I think about some of the stories that we had heard where in particular, an event of or in a community where the government was torturing really indiscriminately members of the community, and then they were dropping them off at the hospital, and the healthcare providers having to negotiate with the police department to at least bring them sooner rather than later, so that they could treat the survivors and have more survivors, so that they could promote more survivorship. And the individuals saying how awful it was to be negotiating with this belligerent government to ensure that they knew they couldn't stop the torture, but at least they could stop the murders. And so I think that in that case, the intention was for them to do the best that they could do. I wouldn't have ever at any point said that they were complicit in the way that we understand, legal complicitness or complicity to be. But at the same time, I think they felt that if they wanted to stay there, they would have to appear to be aligned in ways that they didn't mean to. So I wonder about that, and then I thought it was quite interesting to hear about the feelings of anger, but also guilt and shame in circumstances where individuals might not feel that they had any other choice. And what does that do for their understanding when they're in treatment of what they can and should feel ashamed about and not feel ashamed about? And in philosophy, we talk about imperfect moral contexts. And I think this is an important one for humanitarian settings, because if anything, I mean, I think we probably all live in imperfect moral contexts, but if anybody is working in an imperfect moral context, it's humanitarian responders. And so there are aspects of the context that make it impossible for them to do anything that they can fully celebrate as right, and fully celebrate as the good thing to do, because as you keep describing, the best of actions will be thwarted by contextual features that are simply unjust, right? That are systemically unjust. That those barriers are present. So I guess I would want to explore a little bit more about what we mean by complicity, and is it about feeling complicit at times when maybe it's okay to say that one is not, that one was implicated, that one became entangled, but not necessarily complicit. So I'll stop there with the question.
Thank you, Lisa. That's really interesting. And yeah, I think you're absolutely right that there is a big difference between complicity or guilt in terms of the philosophy of ethics and the psychological feeling of guilt, which may or may not be justified from an objective philosophical perspective. So yeah, I think you're absolutely right there. And Diana, I noticed that you were nodding along very enthusiastically to parts of that. Would you like to chime in now?
Yes, please. And I knew I could rely on Lisa to bring in sort of the philosophical foundations behind all of this, which is really important to consider. I mean, as my colleagues were talking, I was just thinking about perhaps the scale of moral injury that might be experienced, in the world that we live in today, especially speaking on behalf of my generation, the amount of news we consume on a daily basis, the way we're just constantly plugged into world events. And, just thinking about, recent events this week in the US, mass shootings in Uvalde, Texas, and then earlier this month in Buffalo, and how it makes even someone like me, who's a public health student, who's still pursuing her career and hoping to contribute something good in the future using research, it makes me feel like, what can I do to help, advance knowledge about the harms of gun ownership and gun violence on communities. And I know a lot of my colleagues and people I just know are feeling, I think, some type of moral injury this week, thinking about this and how we can be more helpful in preventing mass atrocities like this from happening. So it goes without saying, I think the scale of moral injury that can be experienced, and sort of the vicarious nature of moral injury by consuming media and by just bearing witness, I think is really important to think about, and especially when considering interventions to support particular practitioners or particular groups of people. I think that leads me into talking about a little bit more about humanitarians specifically, and what they might experience, especially going from crisis to crisis. And we know that by nature of being humanitarian, there's a lot of turnover in that field. People will go for a stint for a year or two or less, maybe a couple of months, and then might experience what they call burnout or feelings of guilt that they couldn't contribute more to a crisis or help resolve something, and then they either move on to another place or they leave the field entirely. And that kind of turnover also harms the effective response just by nature of not having, you know, the same qualified people sustaining a response for a long time. And I think that's something that's been brought to the attention of humanitarian organizations, is how can we support our staff more in order to, you know, provide them support throughout their time with us, and how we can help them kind of sustain their mental health and well-being. So there are some interventions, I'll talk about that perhaps later in the session, that have been developed for that very reason. I know, for example, speaking about the Syrian humanitarian response, in particular, what was unique about it was that a lot of Syrians who were displaced to Turkey, where it was one of the hubs for the humanitarian response, they were also part of the humanitarian sector, and they were learning and actively contributing to the response. And they would see their foreign colleagues come and go, you know, people who were coming for a year or two and then, you know, would feel burnt out or wanted to move on to the next thing. But they were still there, and they were still trying, you know, to help, you know, the response in their own country. And that was very difficult for them to see, as people moving on, and then, you know, they're just kind of staying behind, feeling a bit abandoned. And I think that contributes to feelings of moral injury, and being able to really provide a sustainable response from that sense. And then I also wanted to talk about something related to my own research in Germany. So completely different context, high income context, hosting refugees who I was seeing in a clinic in Berlin, who were diagnosed with particular mental health conditions. And I happened to be talking to them about faith-based coping. Something that I've become interested in over time is how you can use faith to sort of help you understand and interpret traumatic events that had occurred to you, or that you were continuing to experience. And a lot of people actually, this wasn't, you know, part of the objectives of the research, but it just came up, but a lot of people were starting to experience, you know, some contentiousness with their faith, and by nature of being persecuted for their beliefs or who they are, their identity, which happens to include, you know, their faith, of course. When they arrived to a secular context, they were all of a sudden thinking about, okay, well, what does my faith even mean if it didn't even support me? You know, my beliefs didn't really support me. And kind of like what happened to me, you know, the scale of what they experienced and the trauma they experienced. And so it was really interesting to see that, because we know in moral injury that, you know, relying on spiritual advisors or spiritual support can be a way to help overcome some of your problems. But what if you were persecuted for those very beliefs, and then that might lead you to kind of distance yourself anyway from things that might have helped you otherwise. And so it's a lot to contend with, but something definitely to think about when considering how to support refugee populations in particular. And I wonder if my colleagues have had similar experiences with the populations they work with.
Thank you, Diana. That is really interesting. And yeah, I've personally witnessed the level of almost churn in humanitarian staff in different projects, where people arrive and then leave only months later in some cases because it's just too much. And there is a very real sense of moral injury and vicarious trauma there. And also really interesting that you brought up the religious dimension as well of moral injury. Simone, is that something that you've come across before?
Yes, sometimes faith or religion can help people to deal with the traumas they have been facing, but it can also work the other way, so that people feel they lose their faith because of what happened to them, and they, which also then they lack a sense of meaning in life and feel hopeless and desperate because of this, and it affects their identity. And when it's relates to moral injury, which is also about the morals, the values they have been learned from childhood on within sometimes a religious context, and they have been violated, this really affects someone's image of oneself and one's identity. So it causes a lot of psychological harm and remorse and feelings of sadness and loss alongside the other emotions that are common in moral injury. Feeling of loss of meaning and like moral disorientation when losing faith because of what you've been through and the choices you had to make
So do you think that means that a lot of the moral injury will come down to choices that individuals have had to make? Or do you
Well,
think that's only one small part of it?
well, what we notice is that it's the subjective idea that you had a choice. So earlier on, we were talking about complicity and whether or not someone actually could do something to prevent a moral transgression from happening. But it's not necessarily the case that people feel like as if they had a choice between two evils, and that's this subjective feeling of guilt is very important in suffering from moral injury, more than what actually happened.
Oh, that's really interesting. Thank you.
Can I pick up on something? Can I jump in, because I think this is also fascinating in relation to the difference between journalists and humanitarian workers is that humanitarian workers obviously go into a situation to directly do good things, to try and help people. Journalists don't have that as their premise. They go in to tell a story. So they don't go in, they go in with fundamentally different aims. But where you see moral injury having similar effects, and I think Diana spoke about this, people becoming disillusioned about religion and their belief system, failing them, becoming a bit cynical about it. You see the same thing with journalists. They feel that my stories aren't going anywhere. My stories are not changing the narrative. Nothing's really changed. I put my life on the line for a long time, but the war continues. People are still getting killed, and they can get a sense of moral hurt and a sense of futility that comes from this, and they start doubting their work, and they start doubting their profession and calling into question, why am I doing this? They start looking back over their career and saying, what difference have I made with my career? I put my life on the line for a couple of decades and the needle hasn't shifted, and they become cynical about journalism. And of course, you don't want to be cynical about your life's work. So you see this frequently happening.
And I imagine even though in a broader sense we can point to certain stories that have had a huge impact, I think a lot of the reporting that took place in Greece in 2015 and 2016 had a huge impact in rallying sympathy for people crossing the Aegean. So you can absolutely point to areas where journalists going to conflict zones or places along the migratory pathway have had a huge impact. I imagine for individual journalists, it must still sometimes feel very fruitless if they don't feel like anything's changing.
Well, that's one of the ways to counteract the sense of moral injury, by pointing out why an independent, good media is so important, because at the end of the day, they do fulfill such an essential part of civil society. But you've got to recalibrate people to that belief, because they can become cynical in terms of, well, I've made no difference. We keep on reporting on mass shootings, they're horrible things, but it keeps happening. Our reporting isn't shifting the needle. Same thing with war and refugees. It's a recurring theme.
Thank you. That's a really good point. And I imagine a really key facet of moral injury in all professionals who are prone to it. We've received a question from the audience. I'm not going to call upon any particular panelist to answer this, because obviously you didn't receive this question in advance, so you've not had a chance to think about it. So instead, I'll simply read it to the panel and to the audience, and then anybody who would like to jump in and comment will be very welcome to do so. Claire says, while making moral injury a mental health diagnosis may not be ideal or appropriate, would categorizing it in health guidelines such as DSM or ICD not help to raise awareness of moral injury, the reality for those who experience it, and potentially access to treatments and support similar to those offered to individuals diagnosed with PTSD? Does anyone feel like they could speak to that?
As I said, moral injury in itself is not a disorder, but it can go hand in hand with like PTSD or depression. So when someone comes to seek help for treatment for PTSD and depression, it could be helpful to explicitly ask for type of events that may have been morally injurious, so they then can get help that suits their specific needs.
Yeah, I mean, I just worry about the creeping annexation of everyday life by the DSM. I mean, that's a separate category, you know, just pathologizing all human emotions and giving them a code and then, you know, getting insurance coverage for it. It's such a messy business. I think we have to be very, very careful of that. I mean, I don't doubt, for one instance, the considerable degree of suffering that can come with moral injury. But I think there's also a risk that if you start labeling too many things mental illness, you chase people away, you kind of put up barriers.
And if I can add to that, I guess too, that if we understand it as distinct from a mental illness, then we can help to remedy the situation as we recognize that there is something external. There is something wrong in the world that needs to be corrected, not not a recalibration of the individual specifically, but a recalibration of how they respond in the world or understand the situation. So I guess I would follow with the question of what kind of training should we expect for healthcare providers who are helping to respond in this way? What sorts of things brought to light particularly, I guess I'm thinking about Dr. Feinstein, Dr. Delaray, that what do you do that you think your colleagues need to know about how to help to respond in circumstances like this?
Should I go? Okay. I believe everything starts with education. People need to understand about what moral injury is and how it can come about, because if you don't understand it, then you're going to make mistakes and you're going to approach it the wrong way. So I find that, providing education, the group that I work with, journalists, can be very helpful. And I do it in a way that, doesn't stress the mental health aspect to it. And I believe, while there are well-described therapies like cognitive processing therapy, et cetera, for severe moral injury, I think a lot of it can be dealt with in a slightly simpler way by helping people understand what it is, but also having a good understanding of what's my profession about? Why am I there? Having an understanding before you go onto the beaches of Greece or Italy, why am I there? What's my role? What does the news organization expect of me? There needs to be a discussion between management and journalists. What is going to be my role? How do I respond? Having some kind of guidelines about what is going to be our response collectively to this humanitarian crisis that we're reporting on? What is my role? How deep do I get in, etc.? Yes, there's going to be a shared humanity. You're going to hand out water to people who are thirsty, etc. If someone's drowning, of course, you can try and help them. But where does this end? And there's so many gray zones over here. People don't know where it ends, and that's where they start getting into trouble. With the missing and Indigenous women in Canada, how far do journalists get involved in the lives of these women? And I could make a persuasive case you don't. You don't get involved in their lives because you're not going to be able to fix it as a journalist. But your strength is that you can inform the population at large about what's going on. You can do sensitive, wonderful reportage that can potentially shift the needle politically, etc. But you've got to know what your role is. You've got to very clearly define parameters. Why am I there? What am I doing? And also to have faith in your work, to believe in what you're doing, to understand that having a free, independent, good media that's reporting responsibly with no fake news, etc., is an essential building block of civil society. And if you're doing that, that can become a very powerful motivating factor. So you kind of recalibrate beliefs around this without necessarily saying this is a mental illness and we need to give it a diagnostic code within the DSM, and provide a treatment to it.
And just to add here, another reason why I would perhaps discourage sort of the medicalization of moral injury, as my colleagues have mentioned, I think is because the feelings associated with it, such as shame and guilt, it's so hard to put your finger on them, especially, within your own kind of culture or using the same language, say English, with populations that you work with. But if you think about transferring feelings of shame or guilt to other cultures and then other contexts where, maybe there's a political situation or a humanitarian situation, I think that's a problem we have with diagnostic criteria for mental health illnesses and kind of the, the typologies of mental illness anyway that we use have been slightly more Western or are informed by kind of Western thinking. And so to capture something like moral injury, which is so nuanced and so values-based, I think it's really hard to, I think, do that and then have this definition sort of apply to almost everyone who's experiencing it. So that's another reason I would add.
Thank you. And I think that actually feeds really well into our last question. Before I ask it, I'll just say I'm posting into the chat the links to social media for Insight Collaborative. We run webinars every month on different topics surrounding migration. So if you've enjoyed this discussion, please do give us a follow, and you'll receive updates on the other work that we do and other webinars that we'll be running in the future. So our last question today, we always like to end with a slightly more optimistic question, because of course there are so many very sad and sometimes very depressing aspects to these discussions. So our last question is, how would you suggest working with and supporting people who have experienced moral injury? Now, Anthony, you brought up the educational aspect, but that's very much with people before they go out into the field. And this is now really around, how do we work with people who have already experienced moral injury? How can we support people who are in that situation? And rather than call on anyone individually, I think it would be nice just for this to be more of a free-flowing discussion. So yeah, anybody who would like to chime in there, please do.
I think I'm the icebreaker. Once again, I think it comes back to education. I really believe very profound. People can come back and they don't understand what they're feeling. They don't understand where their emotions are coming from. And when you can frame it within the context of moral injury, they get it like this. That understanding in itself can be a source of comfort. It kind of removes uncertainty. Why am I feeling this way? And if that doesn't, go far enough, then you've got to kind of, bring in specific forms of psychotherapy. But, education goes a very long way when dealing with this problem.
I think so too. You first need to have some education, and only when things, complaints are really, people have psychological complaints, then you could think about providing treatment, which would be then treatment like acceptance or commitment therapy, or like exposure therapy, what you usually do when people having post-traumatic stress disorder. But that's only when people actually develop complaints. But when it's a moral injury, psychoeducation is very helpful, and support of the organization people work for, and that they have someone to talk to when they have been in the field and have been confronted with all these difficult situations.
And I think building on the idea of education is having interventions between peers, I think, is what we've seen in the literature, especially among aid workers, is peer-to-peer interventions, being able to talk to your peers who are also experiencing, some of the same potentially morally injurious events, being able to process what you're seeing and how you're experiencing it, and then find resources, hopefully provided by your organization, such as a mental health professional or a spiritual advisor, someone who can help you cope with some of these challenges and experiences. And I think these could even take place sort of informally. People in humanitarian settings tend to find, like-minded people, their colleagues mostly, and, try to socialize outside of working hours, just to be able to put some things aside, to forget about what they're seeing throughout the day. But I think it's also important to encourage them to talk about what they're experiencing. There's another intervention that the WHO has put out called self-help, which is a validated intervention for communities experiencing any kind of stress, so potentially can apply to people experiencing moral injury. And I'll put a link in the chat, but it's a very easy to use, very scalable. I think up to groups of 30 intervention that just guides people through, how to kind of mitigate their stress, and especially working with others who are experiencing similar stressors. And so I think there are some valid interventions out there. It's just a matter of connecting the dots and exactly providing that kind of education of regarding the resources that exist.
I think these are great. My contribution here is mainly as a thinking about things as a philosopher again, and some of the concepts that have come up in the work that we've seen. So, first of all, I think we've been talking a lot about tragic choices, and individuals feeling the shame and guilt of having to have made a tragic choice. And in the philosophical literature, people have suggested that maybe a tragic choice is not a choice at all, that it's actually more experienced as a form of torture for the individual. And I think the classic telling of the Sophie's Choice, and the sadistic, Nazi officer that forced her to choose between her children, that there was really no choosing there. That whatever happened, it was just forcing her to cause harm and to feel that self-harm. So I wonder if helping, or pointing out that a tragic choice is not one that one had the control over, the autonomy over, and that actually or agency, I guess, and that what's happening in circumstances like that is that the world is failing the individual. And I think it goes back to what I've heard, everyone say in the discussion, that to point out that the world was wrong, not that individual that was wrong, and help them come to feel that and to see that, and then provide these other options for for the next layer of action, which is yes, dealing with the trauma of it, but also seeing that there are things that need to be corrected, these injustices, the systemic inequities, the genuine harms that are being perpetrated. That's where one could direct one's energies towards making changes. So like the journalists revealing, exposing, raising consciousness about, that's a very powerful thing to be able to do. So if they can see themselves as contributing meaningfully by doing that, then maybe that helps to manage this. But I think also seeing, for seeking good support from colleagues like this would make a big difference as well.
Thank you all. Those are some really interesting points. A tragic choice is no choice at all. That's a very powerful quote right there, Lisa, and very true. I also liked what everybody was saying about education. I wonder if that could be expanded, because you mentioned education in terms of talking to individuals about the moral injury they have experienced and maybe talking about some of these philosophical concepts as well. I wonder if there's also a place for a much broader public education, wider public discourse around moral injury, because it's still a relatively obscure topic. I feel like it is being talked about more, but I imagine the more it's talked about, the more people can be prepared for it before they go out into the field, and the more people can maybe feel less stigmatized if it's something that they experience in the field as well.
Yeah.
Absolutely. And this is why conversations like these are so important too. I mean, even for someone like me who specializes in global mental health and have been thinking about how my work impacts me personally, even the terminology moral injury hasn't really occurred to me. I've thought of it more as secondary trauma. And so having conversations like these can really raise awareness about these issues, and then hearing from experts and the work that's being done, it's quite inspiring. And I think, as you said, Daniel, a way to help destigmatize these conversations. I think it should be perfectly normal to talk about this, because I think we're all experiencing it in one way or another.
Mm-hmm. I'm busy writing a series now for the Globe and Mail in Canada on moral courage, which I take a particular journalist working in a country that doesn't have a good history of press freedom, and I try and work out, why does this journalist go to extraordinary lengths to tell the story when that could entail some really horrendous consequences for them? And I believe that in part, the motivation comes from a sense of moral hurt, the sense of moral injury. I mean, all the speakers today have spoken about, acts of commission, but acts of omission. You fail to do something, and doing nothing in many ways is worse than doing something that could potentially put your life on the line. And so I think when you look around at people doing these extraordinary acts, which you can call acts of moral courage, and for all sorts of reasons, what a better society, a more democratic society, being perpetrators to book, all these kind of things are all true, of course. But underneath it all, I think there's a unifying factor which transgresses cultures, language, countries, etc. There's a sense of moral hurt. What's morally right? What's transgressed by moral compass? And failing to act in response to that, an act of omission becomes even more painful to the individual than doing something. And you see people do extraordinary courageous things as the antidote to moral injury. And obviously people will have their moral compass set at many different levels. Most people would ignore these kind of things. You want to keep your head down and stay safe. I don't want to ignore the authorities who could get me killed. But then they're going to be this group of individuals who have their moral compass set at a certain level that allows them, compels them to do such remarkable things.
I will add that telling those stories is so important too, because as an ethics instructor, right, I teach people ethics in the philosophical ethics, right? But I always say I can teach people about ethics, but I can't teach them moral courage. So to act on what they've learned is something that I think the only thing that we can do is to hear the stories and to explore them and watch them and maybe emulate people who, or attempt to emulate people who have. I think that's the closest that one can get to actually instructing people on having the moral courage to act on the things that they believe in. So I'll be very keen to see those that series in the Globe and Mail, because that will be very important.
Please do send us a link to those when you finish them, Anthony, because I think they'll make very interesting reading.
Sure, will do.
Thank you. I think that's probably a good place to bring it to a close as well. It's been a really fascinating discussion, and it's been really wonderful having such an expert panel who have been working in different fields around this topic, and just shows how many different angles you can look at moral injury from. And in some ways, it feels like we've also barely scratched the surface. I feel like we could definitely have some more panels in the future and really drill down into different aspects of this as well, because there's so much to talk about. But I don't want to take up any more of your time on a Friday afternoon/evening, depending on where you're based. So thank you all so much for attending. We'll be uploading the video to YouTube tomorrow morning. Yeah, I look forward to seeing you all at a panel at some point in the future.
Thank you.
Thank you so
Thank
much.
you.
Thank you.
Thank you all.
Thanks, everyone. Bye-bye.
Bye.
Bye.
Thanks very much. Bye.